But first, I'm joined by the Education Secretary, Nadhim Zahawi. Good morning, Secretary of State.
Morning, sir.
Can we just start with the state of play? Yesterday, 150,000 deaths. Looking back, can we really say that all of those deaths were unavoidable?
Well, of course, we will learn the lessons of how we dealt with the pandemic through the inquiry that we've announced. And that is the right way to do this. One of those 150,000 was my uncle. He was eligible for a vaccine. Sadly, he contracted COVID before we could get him vaccinated. So then we had to wait for that period. But unfortunately, it became very severe and we lost him to this evil virus. So it brings it home to me and to many families that 150,000 are not just numbers, statistics. They are parents, grandparents, uncles, aunts, husbands, wives. So it is important that we learn those lessons, and that inquiry will be able to deliver that. In the meantime, we continue to deal with this virus, with Omicron, which is the infection rates are a quantum higher than Delta. But thankfully, the booster seems to be working incredibly well. And you look at although the number of people going into hospital is rising still, but actually the people on ICU has been coming down, which again demonstrates that the vaccines are the best way out of this pandemic, because they, again, weaken the link between infection rates and severe infection, and of course hospitalisation and death, thankfully. So 90% of over 12-year-olds now have had a single vaccine, which is great to see that uptake and vaccine hesitancy decreasing, including, of course, over the Christmas period. Many people who've never been vaccinated came forward to be vaccinated. And 90% over 50s have had a booster. And so I'm confident that the way out of this, and as we transition this virus from pandemic to endemic, I hope we'll be one of the first. You asked me the question, how well we've performed. I hope we'll be one of the first major economies to demonstrate to the world how you transition from pandemic to endemic, and then deal with this, however long it remains with us, whether 5, 6, 7, 10 years.
I want to unpack that, but just before we leave the 150,000 figure, there will be families like your own who they will, I won't say look forward, but they will be anticipating the inquiry. But your relatives and families like yours probably already know that, and this is not pointing the finger, but they probably already know that much of what we did was too little too late, wasn't it?
I don't agree with that. And if you look at my role in this with the vaccine deployment...
You were the success.
Well, but also we've had many successes. So one of the big successes now, obviously, is the antivirals. And Sajid Javid, the Health Secretary, has ordered over 5 million antivirals. Of course, the success is testing. We've tested twice as many people in the UK than France has done, I think about 4 times, and Germany has done. Over the past 2 years, we've done 400 million plus tests. If I tell you that in January alone, we've ordered 425 million lateral flow devices. People can get their tests. Schools opened last week. We asked secondary schools to test at school. We got 31 million kits delivered because I got them to order from November, and we had a different supply chain for schools. We're going to get another 17.6 million out by this week. And so there's many successes in terms of our diagnostics capability. We had not much diagnostics capability to speak of in the UK. Now we are a behemoth when it comes to testing, diagnostics, and of course vaccination. Not just for the UK, but for the rest of the world as well.
Let's talk about where we go from here. You have already said this morning that you think that we are moving from pandemic to endemic. Let's talk about some of the signals of that. When do you want the isolation period to move from 7 days to 5 days?
So the UK Health and Security Agency did a very good blog on this, and your viewers should actually have a look at that. And what they looked at is, because people said, the Americans at 5 days, why are we at 7 days? Actually, we begin our isolation period when people get symptoms. In the US, it's when they test positive. So we have to be careful as to whether we move, because what you could end up is actually a perverse incentive where the spike is higher because people come out of isolation too early. But they said they will review it, and if the evidence is there, where if you are asymptomatic and you are vaccinated and boosted, and you have 2 consecutive days of negative lateral flow tests, they said they will keep that under review. Of course, it would help for...
And you want that to happen as soon as possible?
Well, I would obviously always defer to the scientific advice on this. It would certainly, help mitigate some of the pressures on, schools, on critical workforce and others. But I would absolutely be, driven by the advice from the experts, the scientists, on whether we should move to 5 days from 7 days. Otherwise, what you don't want is obviously to create the wrong outcome by higher levels of infection.
But you want that to happen. Another suggestion that's apparently coming forward, and I think you are associated with this, that lateral flow tests at some point are going to have to stop being free. If this is an endemic condition, when do you want that to happen?
I saw that story this morning, which I was slightly puzzled by, because I don't recognise it at all. This is absolutely not where we are at. On the contrary, I've just said to you in my opening remarks that for January alone, we've got 425 million lateral flow tests coming in, and they'll continue to be available for free, because actually we've got 3 lines of defence: the booster, and obviously vaccination if you haven't been vaccinated, testing, and antivirals. And all those 3 things are really... So I don't really recognise where that story is coming from.
So to be clear, there are no plans at the moment...
Absolutely not.
...to stop lateral flow tests being free?
Absolutely not.
The former head of the vaccine task force says that we should end the mass vaccination campaign after this booster round and move to something called normality. Do you think that's right? 3rd booster, and then we treat this like normal annual flu?
Well, one of the, actually real great things we have in the UK is people like Clive Dix, who you're referring to, and of course Kate Bingham and Richard Sykes, who's now chairing the Vaccine Task Force, and others who are brilliant Brits who are world experts in this area. So I would certainly look at the evidence. All I would say is actually we know that the booster campaign has worked incredibly well in terms of preventing infection, but also in preventing hospitalisation. And so we want to continue with that. I would obviously, look at what the JCVI would say on this for future variants, because we are going to have to live with this virus. It will deliver other variants, this year, next year, and beyond. And I think the great thing is vaccines are getting better. So we're getting, polyvalent, multivalent vaccines that will deliver greater protection against many other variants of the virus, as well as, of course, the antiviral. So we will continue to improve, but live with it.
That's a future. You're painting a pretty optimistic picture this morning, but let's be clear. From the A&E wards of our hospitals, it doesn't quite look like that. Ambulances are having to wait to move patients into beds. You're bringing military personnel in to help. Health leaders are saying there could be 25% down in staff numbers. Staff absence tripled since the beginning of December. The truth is, the system is already pretty near collapse. And that's today's problem rather than the sunlit uplands of tomorrow, isn't it?
So the first thing to say on that is the ambulance units, and we've got 4,000 now, I think a 500 increase on what we had pre-COVID. The NHS frontline, the NHS support staff have done a tremendous job. If you look at the school, the hospitals... We've
got to deal with where we are today.
Absolutely. So they are under pressure because, obviously, of the quantum higher infection rates with Omicron versus Delta, and therefore that 7-day isolation period associated with that. But if you look at the number of hospital trusts that have declared a critical incident, there's 24.
Indeed.
Right? Which
a lot.
There's about 130 plus hospital trusts. Out of that, there's 24. In 2017-18, 23 hospital trusts declared a critical incident. So it is a mechanism that the NHS uses very well in times of very high pressure on the system. The NHS is very good because they've got this ability to digital passport staff between trusts that's also capable. We are launching 8 Nightingale sites. We are probably going beyond that to increase capacity as well. There are now 10,000 plus additional nurses in the NHS, 4,000 plus additional doctors in the NHS.
I am getting the list of your output.
Yes.
What I'm putting to you, however, is that there are doctors who are saying we're on our knees. There are nurses who are saying the shifts are not, that we're depleted in each shift. There are people who are saying that actually we're not getting treatments because, and Sky had done reports of people who have lost relatives because of the crisis in hospitals. Now, you can tell me all of the things that you're doing, but the point is, actually, the more you tell me that you're doing, the more I wonder if it's enough, because actually, if you're doing all of this and we're still having this situation, there's a crisis. Aren't you being a bit complacent?
Not at all. It is, as Sajid Javid said, it is a rocky few weeks. I would say this is a really tough time. That is absolutely right, because obviously we've got people who are absent because of having to self-isolate. But what we're doing is doing everything we can to make sure that the NHS has the ability to ride out this bump in the road for the virus. Within that is the additional $5 billion for just this 6 months of money being made available by the Chancellor, Rishi Sunak, to help the NHS weather this storm. And that's the right thing to do, including, by the way, for example, in 1 week, we've had overseas nurses, something like 900 overseas nurses registered in 1 week. So we know that there are staffing pressures, but we're trying to mitigate against them by recruiting more nurses, 50,000 over this Parliament.
All right.
Doctors,
let me come...
And, of course, the military helping and other parts of government.
Let me come back to your own particular responsibility. You're sending ventilator kits to schools, you've mandated masks, but you're not going to know the effect of the return. Are you sure you've done as much as you could do?
We are continuing to monitor the situation. So what we did was, before Christmas, we made sure schools ordered their kits for the testing. Before that, in November, we got 350,000 CO2 monitors at the cost of £25 million so that we can monitor the atmosphere in the classrooms. From that data, we're able to model to say, actually, we need about 8,000 air purifiers for those classrooms that need the help that they can't mitigate for making sure that air is circulated and fresh in the classroom. We're getting those out this coming week. Obviously, we prioritise special schools and schools in alternative provision because those kids are the most vulnerable. And, of course, as of Monday, we continue the school vaccination programme.
Do you feel assured we're not going to have to send children home or close schools?
So I will do everything in my power. I was at Hammersmith Academy last week, and I saw how brilliantly they did with testing their pupils and getting back to education. School leaders, teachers, by the way, the support staff, and a big shout out to the support staff, because without them, we couldn't do any of this. I'm confident we'll be able to cope.
I don't want to cut you short, but I do want to talk to you about the economy, because, of course, that is actually, for most people, the thing that is looming. It's not looking great. Most people are going to see an actual cut in their take-home in April because of tax rises. We are likely to see an energy price rise, could be anything up to several £100 a month for the average household. And right behind that, inflation coming down the track. Why don't you reconsider, as I think some of your cabinet colleagues want, the rise in national insurance? Because the cost of living is going to be catastrophic. Rise could be catastrophic.
So let me just pull you up on your first sentence. The UK economy, because of the action we took over COVID and how we've coped with Omicron, is going to be one of the fastest growing economies in the G20.
Yeah. We can have an argument about GDP numbers. What I want to talk to you about is household budgets.
I hear you.
And what people feel like.
Right. And so what's the best way for people to cope with the cost of living? Is to have a job, right? We have the highest level of employment.
Hold on. This is a great answer. But I'm talking to you about people who have jobs, who are in work, who are going to find that there are hundreds of pounds coming out of their pocket because of your tax rises. Deal with that.
Right. So allow me to finish that point. So who are those people? Those people are the people on universal credit. right? The taper...
No.
The taper, no, some of them are.
You keep going off into a direction rather than the one that answering my question.
I am answering the question.
The average household,
yes,
a lot of whom are in jobs,
yes,
not in receipt of
yes,
benefits.
Yes.
They will feel the tax rise and the price rise. Why not deal with that?
OK, so the national living wage going up to £9.50 in April, same time, right? The universal credit taper does make a difference, about £1,000 for those who are probably finding it most difficult to cope. The energy price cap remains in place. £500 million to local government because they know which families need the most help with those utility bills. £500 million going to them, as well as the winter fuel allowance, which is a £140 rebate. That will rise to £150 in October, taking more people. It takes in 2.2 million people, 2.7 million people in October.
You're not talking about people who are in work. Look,
they are in work. Why wouldn't they be in work? They are in work, Trevor.
We're coming to the end of this, but
sure.
And we can talk around this a lot. But isn't a fundamental problem here that your Chancellor doesn't appear to have a plan to ease the pressure on household budgets? I know you can talk about the people who are at the margins and so on, but the average household is what I'm asking about. The business secretary doesn't seem to have a new plan to support businesses ravaged by COVID, no furlough or anything like that. I don't know what you're going to do about sick teachers. The point is, the government doesn't really feel like it's got a plan to deal with this cost of living crisis. Prime Minister seems to be saying, put my hands together and then pray.
No, not true. I tell you for what. You asked me about the NIC rise. Okay. Let's look at that, right? Now, we know that 36 billion is absolutely the right thing to do to deal with adult social care and the backlog of the NHS, right? Who's paying for it? 14% of the highest earners pay 50% of that rise. 6.6 million of those who really are right at the bottom of earning pay nothing for the NIC. Okay. So it's worth putting in perspective. It is as progressive as you can be whilst delivering on adult social care and the backlog of the NHS. That makes a huge difference. The business secretary is meeting literally all the time to deal with the energy spike in gas prices.
I'm sorry, I'm going to have to stop you because we have other guests waiting. And I am sure you and I are going to have this conversation many times in the coming weeks. Thank you for your time this morning.
Thank you.